Hello, everybody. I am Dr. Mangesh Tiwaskar. I am consultant physician and diabetologist practicing in city of Mumbai since last 3 decades. I also shoulder the responsibility of being editor-in-chief of the Journal of Association of Physicians of India, that is JAPI. We are going to discuss today about one very important problem that exists in the Indian population and especially the aging population. We are going to talk to you about the role of vitamin B12 deficiency. Now understand that prevalence of vitamin B12 deficiency, especially in the elder adults in India, is nearly around 20 to 90%. And especially in the northeastern state, nearly 90% of elderlies have been reported to have vitamin B12 deficiency. And the general cause is usually the inadequate intake of vitamin B12, or there can be an associated malabsorption. And especially in elderly, because of this high incidence of atrophic gastritis, there is a significant malabsorption that happens, leading to what we know commonly as pernicious anemia or megaloblastic anemia, especially due to this vitamin B12 deficiency. So understand that vitamin B12 can affect multi-organ systems and can cause wide spectrum of clinical manifestations. So now let us look at what are the clinical manifestations of B12 deficiency. Now elderlies, those who suffer from the B12 deficiency, will suffer with the cardiovascular challenge and the neuropsychiatric complications. There are so many other challenges that these patients can suffer, but the cardiovascular and the neurovascular and the neuropsychiatric complications are fairly common when you have got vitamin B12 deficiency. Even though not all the elderlies will develop these clinical situations, but few of them will definitely develop this medico-clinical challenge. Now, the low vitamin deficiency, especially B12 deficiency, can also associatedly elevate the homocysteine level. And we all are aware that whenever the homocysteine levels they go up, that means that whenever we have what we call it as hyperhomocysteinemia, this can further increase the possibility of developing the coronary artery disease, or what we call it as a heart disease. So low serum vitamin B12 also not only can increase the cognitive impairment, but will also increase the risk of development of hyperhomocysteinemia, and the cognitive impairment can be as high as around 2 to 4 times or fold. Individuals, especially with Alzheimer's disease, will always have the notable challenge of increase in the occurrence of low serum vitamin B12 levels. And this usually happens primarily because of what we call it as an amyloid deposition and the hyperphosphorylation of what is the most important causative protein, that is tau protein, in the patients of Alzheimer's disease. Understand, vitamin B12 deficiency can also lead to depression, and due to lack of vitamin B12, there can be a possibility of increase in the probability of experiencing the depressive disorders, which can alter not only the behavior, but as a whole can alter the metabolism as well, and also which will change the way the antidepressants they work. So low vitamin B12 levels can cause severe neuropsychiatric challenges, and along with that, it can also cause reduction in the bone density or bone mineral density, leading to increase in the risk of osteoporosis. Additionally, if the patient is diabetic, then patients they have increased risk of developing the peripheral neuropathy. And understand that there are drugs like metformin, whenever they are concomitantly used for the treatment of diabetes, if vitamin B12 deficiency is associated with a high dose of metformin therapy for a longer duration of the time, then probably you may definitely increase having the patients of developing the peripheral neuropathy and the related challenges. And especially older patients with type 2 diabetes have got higher incidence of low B12 stores, and even with the shorter treatment with metformin, these B12 deficiency can manifest with severe neuropathy. Another point here is that whenever B12 deficiency and metformin therapy exists concomitantly, it will not only worsen the nerve damage, but also will worsen the recovery part of the story. So metformin induced nerve damage along with the B12 deficiency induced nerve damage will increase the incidence of neuropathy. Hence, we have to be very, very watchful, especially in elderlies, those who are on with metformin for the presence of B12 deficiency. Understand, not all the serum vitamin B12 present is usually in a metabolically active form in the body. And that can also reduce down the effectivity of the vitamin B12, especially in the nerve tissues or the peripheral tissues. So normal vitamin B12 can sometimes be very misleading investigations, and especially whenever it is associated with liver diseases, with myeloproliferative disorders, with congenital transcobalamin deficiency, and also with the intestinal bacterial overgrowth, or what we call it as the upset gut flora. It is universally accepted that the cutoff for defining the deficiency is usually around the vitamin B12 levels less than 200 picograms per ml. Even though this is not accepted very well everywhere, but generally this is the cutoff which will surely call for the evaluation of the patient and management of the patient with the replacement of the vitamin B12 deficiency. So ongoing vitamin B12 therapy could aid in preventing and worsening of the symptoms of the clinical challenges that these patients they have. And along with that, ongoing vitamin B12 therapy will also help in reducing down the burden of hyperhomocystinemia, which can be a single risk factor for development of the premature coronary artery disease. And especially in elder population, you have to be very, very careful. So friends, timely screening for a vitamin B12 deficiency, finding out about the vitamin B12 levels in the serum, and supplementing the vitamin B12 in the recommended daily dosages will surely reduce down the possibility of decline in the biological functions. The people, those who are susceptible to develop, will reduce down the risk of developing the clinical consequences, and will further improve the overall well-being of all these patients, and especially the elderly that they deal with. The recommended dietary allowance for vitamin B12 is around 2.2 micrograms per day and should be given regularly and continuously to maintain the optimal health. Thank you very much.